Welcome to ParentMD. Today we have with us our guest, Dr. Steve Goudy. Welcome.
Glad to be here. Thanks for inviting me, Josh.
Yep, glad to have you. So Steve and I go way back. We went to medical school at the University of Louisville, 1994 to 1998. We both went different paths, but similar paths. I went to pediatrics. He went to pediatric ENT. And so glad to bring him back today for conversation. And to start out, I would like to just ask him to give us a bit about his where he's from, his education, training, and career path.
Thanks, Josh. Grew up in Louisville, Kentucky. So born and raised here in Kentucky. Went to medical school and residency here. Went to the University of Iowa for a pediatric ENT fellowship. So otolaryngology is a big, long, fancy word, but ENT is just fine. And then went to Vanderbilt and worked there for 10 years. And now I've been at Emory and Children's Healthcare of Atlanta for the last 7.
And talk to us a little bit so the viewers can get to know how your brain thinks. Why did you pick pediatric otolaryngology?
So I love kids. In general, they haven't created their own problem. They just want to get better, faster, and go back to what they were doing. So that part's great. I do like surgery, and otolaryngology or ENT allows me to see patients in the clinic, spend about half of my time there, and then take my patients to the operating room who need it, and then follow them back in the clinic. So it's a nice combination of things. We do lots of procedures. We're involved in kind of monitoring and measuring the different senses in the head and neck, hearing, smelling, tasting. So it's fun. Kids are fun to play with and hang out with. So it makes my job pretty cool.
Yeah, as a pediatrician, obviously having pediatric ENTs on your speed dial key, given all the ear infections and the things that you do, which is why we want to bring you with ParentMD so we could talk about other topics, not other topics, but the topics that are most important to parents. And namely, some of those we just create some toolkits in the studio on. So why don't you talk a little bit about the toolkits that we put together?
Yeah, it's great. I think that what you're doing is very impactful for families is that we all want the best information, but open up Google and you get more information than you can possibly process, and you don't know who to trust. So I think what you've done is bringing experts like myself and others that are thought leaders in the education field, addressing very common problems, meaning ear infections, what to do. I think most of the listeners will have had an ear infection, but they don't understand how it occurs, why is it more frequent in babies, what are the considerations versus, around antibiotics or surgery. Same thing with recurrent sore throats and snoring, sinus infections, all of those things that we all experience commonly, and particularly children experience a lot. But yet you don't have the best information is hugely important to be an informed consumer, right? Like if I'm buying something, I do a lot of research. I look at the reviews, I see what people are saying, but if you don't know where to go to get that information, then you're at a disadvantage.
So what are the biggest myths that parents find or believe they see when they see it on the internet when it comes to your field?
Fortunately, there's a lot of good healthcare providers out there. So, pediatricians like yourself, family practice doctors, nurse practitioners. So, in general, the folks that come to my office have been well educated by their care provider. Having said that, I know that there's other information out there where there may not be as much evidence about how what they're doing is helping their child. An example would be chiropractic care for ear infections. And, you can kind of give me your opinion. I don't know that it works or doesn't work because there's just no information. And so certain families will come and say, well, we are not interested in doing what you're recommending. We're going to go do this other care path. And people, that's all about shared decision making. We sit down at a table kind of like this and talk about what's best for your kid. If what you're doing isn't evidence-based, then you really need to think carefully about that. Fortunately, most of us in healthcare provide evidence-based recommendations and therefore, don't get into that quandary. I would say some of the stumbling blocks are things that are harder to, converse about or discuss with families is antibiotics for ear infections, what's the risk of surgery or observation, and those kinds of things are important discussions. And there's good data to have those discussions with the family.
Those are all great points, and we could talk all day about many of those. But when you mentioned shared decision making,
Mm-hmm.
shared decision making, I think, is the hardest when you've each got a different approach. It's nice when parents find physicians that they have the same approach, philosophy on how to take care of the child. On that note, how does being a parent of 3 impact how you help with shared decision making for those quandary questions that are in the gray and it's not clear? And parents may not be totally aligned with your philosophy of medicine, but how is being a parent impact that?
I mean, I think being a parent helps you understand the vulnerability and the scaredness with which the families and the patients come to the conversation. Without that sense of vulnerability, and each one of us handles our vulnerability different. So it may be anger, it may be crying, it may be whatever that it is, but sitting at the table, expressing your concerns, knowing how they feel vulnerable, and assuming this is not a life or death, now or never kind of decision making, help initiate that conversation, make sure they understand the place that you're coming from. And for me, I don't really care if I'm the person that takes you to that place of resolution. It's just helping the family understand they need to get to that place based on the set of facts that we're discussing. And I'm happy to send you down the street or across the state or wherever you want to go so you can get to that, that relief of your child's burden of disease, if that makes sense.
Yeah, no, completely. So I would gather in your world, probably the hardest decision that has to be made is to do or not to do something. And it's a binary decision. It sounds simple, but I mean, it's to put tubes in or not put tubes in, continue another course of antibiotics, not remove the lymph node, watch it for a little bit longer. I mean, I would assume those are the things that you spend so much time with parents on, is the whether to do something or watch it a little bit longer, correct?
Right. And the good news is that our societies, the American Academy of Pediatrics, the American Association of Otolaryngology, Head and Neck Surgery, American Family Practice Society, all of those organizations recognize some of these high volume, problems like ear infections and come up with guidelines. So for me, I'm a rule follower. It helps me at home. It helps me at work. So if I execute and follow the rules and communicate those in a way that's understandable to the families and allow them to make a decision, I think is good. I would say that historically our society has been somewhat, patriarchal or kind of like the doctor comes in and says, okay, you're going to do X, Y, or Z thing. It's not like that anymore in general.
Agree.
And you should find a provider that sits down and has that it's a conversation. And I think that conversation can't be had if you don't have, as a family, an understanding of what are the problems we're trying to solve? How bad is this bothering us? Do we understand what our alternatives are? And do I understand why you, as the surgeon or the pediatrician, have made a recommendation, right? So all I do is make recommendations. And personally, for me, I'm not going to operate on anybody that's not 100% certain why they're there, right? Because I need that to be able to know that you will want to heal, that you're a family, you believe in me as a clinician, as a human. Because otherwise, I mean, there's plenty of doctors out there. I'm not the only one. And so you need to find that right fit for you so that there's no hurdles or obstacles. Because if there are bumps in the road, I don't want there to be question in my mind or your mind why we're there.
So, no, it's a great point for parents to hear and understand. I think the right physicians are aligned and will not do a procedure unless, number one, they think it's the right thing for the child, and number two, the parent is aligned to think that it's the right thing. Otherwise, the parent probably needs to identify with someone that they are aligned with in their approach to the child if you're in disagreement. And it's quite all right for folks to disagree. We've all got different opinions, but I do like what you noted earlier, that as medicine has become more mature through the decades, we're more evidence-based, and which has therefore led to more guidelines, which helps us to help manage people from a population standpoint, yet remembering the art of medicine, that every patient's unique and there's a unique story, and we have to weigh the guidelines and the science with what's best for that one child. And that, to me, is the fun part of medicine. And that's where it's a beautiful thing when the parent and the doctor work as a team on the behalf of what's essential. The question is, what is best for that patient right now? And that may not be the same thing that's best for another patient who looks very similar on another given day, right?
Right. And as I tell the families, I'm happy to be proved wrong. I'm happy for you to get a second opinion, a third opinion, or whatever, as long as we're not denying that there's something that needs to be addressed and treated, particularly if it's something worrisome like cancer or, a lymph node or whatever. Yet, I want people to have the information and have the shared decision making, and it's hard, right? So in our country, there are big deserts of, lack of physician resources, family, I live in the state of Georgia, and you can drive 4 or 5 hours to get to where I am, and so there's physical barriers. Like, do I go see Dr. Goudy, or do I feed my family, or the gas money? I mean, so there's lots and lots of hurdles in our society. And so, I don't want to keep dragging people around and making them come back to make decisions.
Right.
Yet we also have to be realistic about, like, hey, you live 5 hours away, and every time you come to see me, we're making choices about how you support and care for your family, or how do you even get here because you don't have the gas money, versus, as you said, there's the evidence, there's the patient, there's the reality of their personal situation, and how do we kind of prioritize each of those to get the best outcome for their children.
So back to passion and what drives you and why you picked this field. You mentioned earlier conversation that you do some mission trips. Why don't you talk a little bit about that?
Well, obviously pre-pandemic, actually in February of 2020, I was in the Philippines. We're sitting around like, is this going to be a big deal? I'm like, it's seemingly going to be a big deal, So the pandemic has changed global healthcare providers, approach to, mission trips. And there's a lot of different opinions about it. In general, we as physicians feel like all humans should have access to healthcare and healthcare delivery. Certainly in the U.S., we are fortunate, even though our healthcare system isn't perfect, we're fortunate to have a health system that has very robust care systems, and in general, people can get what they need, but there's a lot of barriers. Having said that, going to the Philippines, where I've gone for the last 20 years, clinical conditions like cleft lip and cleft palate that in general in our society are addressed timely, sometimes aren't addressed as timely there just due to lack of resources and access, and again, that same choice of gas money to get to the place versus not. And so it is a way that I can give back and use my talents to impact people who I don't live close to, but are in need, and can literally change the face of their future, and allows me to give back in a way that's impactful and meaningful to me.
So you're a family guy, you are a clinician, you're a leader in an academic setting, but you're also a business guy. So you started a company the last couple of years called Doctor Knows Best, and you actually have a product that you identified a need, a gap in care, something that would help parents. And talk a little bit about that.
Right. So being a pediatric ENT doctor and a father of 3, I look at a lot of snotty noses, and have had the same conversation both with my wife as well as lots of different families of, hey, there's not a great way to clean my kid's nose. People don't realize that babies are obligate nasal breathers for the first year of life. You and I know that. They teach us that in medical school and residency, but if you didn't know your baby can't breathe through their mouth, and then you don't understand why they have such a hard time with colds and so on. And so you and I have seen lots of kids that are admitted to the hospital have RSV or something else just for nasal suction and nasal hygiene, and why in current day and age we didn't have a better nasal suction device was curious to me. And families would be like, look, I don't need you, I just need the suction on the wall, get me out of here, please. And so Doctor Knows Best is our company that's focused on delivering content much like what ParentMD does, just to be a source of aid to families, but also we offer a differentiated product solution that meets that need of that hospital grade suction that you can have in your home that, will help your baby breathe better and then eat better and then sleep better. And so we are going to develop a suite or a host of products that support the families in caring for their babies at home.
No, that's awesome. And, we talked about this over a year ago when you were getting started with the concept and the product. I told you my passion that ParentMD would not only create some content, but we'd find great content, but also want to go find great products and services out there that I knew would be of value to parents and essentially someday put the ParentMD certified stamp of approval on. We know this is one of those products, and this isn't meant to be a commercial for that at all. I think it's a great resource to share for parents and to share the history and story of how, excuse me, a doctor identified a need clinically and found a solution, and it helps a lot of parents. I mean, that little blue bulb that we all took home with our kids from the hospital just doesn't cut it. But to have something, when I saw the uniqueness of how you can hold it in your hand and hold the head at the same time and it be cordless and have powerful suction, I was like, wow, that solves a lot of problems. So congratulations, good luck on that. And I think it'd be great for parents to learn about that product and others because, again, it makes their lives better and it makes the children's lives better. And that's what ParentMD is all about. So good luck with that and look forward to seeing how that goes. And I've got a feeling you will come up with other products and other ideas that meet those needs as you create this machine. And that's the fun thing in the business side is that you can then bring things to market that actually help people. With that, let's change gears for just a second. I'd like to end on the note of one of the nuggets I like to try to get from folks during these conversations is from your experience as a parent and your experience as a doctor. A couple places I want to go. One is, what's your best advice for parents? We're going to do that first. And then next, I'd like to hear from you what your best advice is for fellow doctors taking care of kids, whether it be surgeons or pediatricians, family practice doctors, nurse practitioners, what. But let's come back to the parents piece. I have two boys I've shared that are 24 and 21. You have three children. There's a lot we've learned. There's a lot I wish I'd done differently, a lot I'm glad I did, and it's a learning. But there's a lot of advice, I think, for all parents to share with one another, which is another thing for the listeners out there. I want them to know that I want ParentMD not just to be a clinical place, but a place that we share information, resources, advice, and counsel from a lot of great resources on rearing your children and the family dynamics and just getting through those stressors. So it's not just about the clinical. It's kind of like behavioral, mental health, and it's pulled away from the clinical, but that's just as important as what's organically going on with your body. Same with everything else. I think parenting has so much to do with the support in the clinical side too. So with that, I'm rambling. What is your best advice to parents that you would give them?
Wow, that's a big question. So I would say we talked about the vulnerability earlier, and I think that people don't understand that, and so the self-awareness is key. Like, how do I respond? What is my response, or how do I respond in times of stress? How do I partner? What is my partner's feelings? What is their response to stress? What do they do in that sense of vulnerability? Because we know, I mean, there's good studies that show that if you don't get enough sleep and you're stressed and you're tired, you're not going to be at your best at work. You're not going to be at your best at home. It really is stressful. And I think that is one of the things that people are coming and talking more about that. Postpartum depression is a real thing, right? And so things that I would do differently now, now that my kids are older, I would have a lot more self-awareness, right? So when I was 30, I was just focused on my career. I mean, really, I was a resident. I was, getting up early, coming home late. I wasn't a great spouse, probably not the best dad that I could be, because my insight into my stress responses, into my spouse's stress responses, I could have done a lot better, Josh, and so I think that is understanding yourself and being able to talk about that freely without as, not completely devoid of emotion, but as objectively as you can. It's like, hey, approach it like a business. Like, hey, we want to win this parenting game. What are our capabilities? What am I really good at? What am I terrible at? How do we complement each other? How do we regroup after a hard day and say it's going to be okay? Because that's hard.
Yeah, that's a great. I'm just digesting a lot of what you said. For me, it's a lot of the same feelings, observations, and I've shared that on some of these other podcasts. My regrets of not being more patient, more listening, things I could have done better. And I think it's a great way to put it, that understand your own vulnerability, understand insight, which, sad to say, I know a lot of people are much more mature and wise in their younger years, but so much of this for me only gets better as I get older. So what I know and understand and insight and being vulnerable or understand other people's feelings definitely matures as we get older. And the sad thing for me, and I think for a lot of us who take care of parents and kids, though, is we recognize that, I'm just going to say it, these families, as we all were, we had kids in our 20s and 30s. You just don't have enough life to understand a few things. You don't appreciate that kids grow up so quickly. They're gone. And you don't get a chance to redo. And, you're busy trying to survive, get through the school, or make the dollars to pay the bills. And your time and focus is sometimes everywhere but where it needs to be. Often it was for me. But to look back, I'm with you on that. And if parents could just understand and appreciate I like what you talked about, essentially about sensitivity and appreciate understanding of your partner too, whoever you're raising these kids with, and look at how do we do this well together. I love that. Great advice. So when it comes to your fellow doctors and taking care, and let's do this in the vein of taking care of patients, what would be your advice to the younger physicians getting started and what you've learned and maybe you wish done differently or you've learned along the way is high value that you didn't appreciate till now? Again, I think some of these things are only learned through time. I wish I had my older self to teach my younger self 20 years ago to do a little differently. So what would you tell your younger self? What would you tell the younger physicians now as they're getting started?
Well, I am fortunate to have a group that works alongside me that are younger, or at least have less gray hair than I do. But I think and I'm going to say this, Josh, with all the love, the older generation, meaning you and I, right, need to do things differently. There's no reason why it should be this kind of apprenticeship, and when you're old, you kind of identify that you could have done things better when you're younger.
Mm-hmm.
So I've invested in our team doing self-awareness, doing self-reflection, because, as an example, one of my partners was not having great patient satisfaction scores. We get graded on that now. That affects our compensation.
Yeah,
There's a lot of things tied to that, which is fine. It's good.
Yeah.
Patients should expect and do expect a good patient experience. But if you're not self-aware, if you're not reflecting, if you're not improving, then you're just kind of learning by trial and error, right? And so for the physicians that are coming out of, medical school, out of residency, if you're not going into a practice where they're going to mentor you, there's active mentorship, career development, growth. You need to do that yourself, because otherwise it's trial and error. Whereas if you go into a big company like Accenture, they have a very formalized program where they're developing their talent to be high performing, and I don't think there's anybody that wants to be low performing, particularly in medicine. So using some of that business mindedness to look at yourself as a high performing, person, maybe, as a baseball analogy, you're going to go to the farm team and, and they're going to work on how you throw the ball over and over and over and over. But if that's just trial and error, you're not going to make it to the majors, right? So you have to invest in people and or yourself to become more self-aware, because then you can kind of deliver on the good things and focus on that rather than stepping on landmines. I stepped on a lot of landmines. Like I've learned the hard way a bunch of times, and there's no reason, you don't have to do that, right? There's better ways of doing that. So, again, it's understanding yourself, understanding your stress behaviors, making sure that you create an environment where somebody's going to come to you and say, Dr. Honaker, I think what you're getting ready to do isn't right. That psychological safety You know, like, because if you're insecure, you're frustrated, you're expressing your vulnerability with anger, people are just going to sit in the corner like, he's getting ready to mess up.
No,
I'm
leave
not
you
going
be.
I'm not going to say anything because he's going to bite my head off.
Yep.
Right. And so, yeah, it seems like a lot of soft, squishy stuff, but when you're taking care of people and patients and the stress, if you're like starting your own practice, I mean, there's a lot of pressures. And if you don't deal with that, it's going to affect you and everybody around you.
Yeah, the emotional and social IQ, we all appreciate more and more. And thankfully, society and our educational institutions are thinking about that. I think, 20 plus years ago when we got into medicine, they were really focusing more on patient experience and what the patient satisfaction was all about. And we were kind of getting that space. I appreciate your vulnerability in sharing that. I've had those moments where I had maybe not the best experience with someone, a patient or another doctor, but the times I appreciate, and they were the hardest at that moment. But I grew the most from it. Someone who did what you just said, they felt safe enough, or they just thought they needed to is the right thing to share with you that honest feedback. And if all doctors are honest, like all professionals and everybody walking through life, you're going to get honest feedback sometimes. It's a matter of what you do with it. And some of the best feedback I got was from parents in a note or talking to me outside of the exam room and sharing something, usually in love and no malintent. And man, some of those were the hardest things because I'm a people pleaser. I so care what people think, and I know you are too. But, it's funny when we, all doctors think that they're in the top 5% of all doctors in every form, and that's just not the case. And so many of us have blinders on at times. But I really appreciate your point on vulnerability and insight, and that's great feedback for young doctors and other parents as well. So very rich. Appreciate your time with us today, Steve. Great to get reacquainted, reconnect over the last couple of years, given our ventures with ParentMD and Doctors Knows Best, and coming together, and hopefully we can share great nuggets, information, and such with other parents and continue on the journey, and look forward to you coming back to the studio again in the near future.
Yeah, my pleasure. Thank you for having me.
Thank you, Steve.
Thanks.